The PAP Test, HPV. This patient resource was adapted by the Society of Canadian Colposcopists, SCC, with the permission of the BC Colposcopy Program. This patient resource was made possible through the support of Merck Canada, Inc. The opinions expressed in this material are those of the authors and do not necessarily reflect the views of Merck Canada, Inc. A PAP test is a way to screen for cervical cancer by finding precancerous changes in the cervix. During a PAP test, an instrument called a speculum is placed into the vagina to help see your cervix. Cells are collected from the cervix and examined under a microscope. The PAP test can find changes in the cells of the cervix before they have time to turn into cancer. Regular PAP tests reduce your chance of getting cervical cancer by 70%. In most provinces, healthcare providers recommend that sexually active women begin getting regular PAP tests at age 25. Some provinces start at age 21, but many are changing to 25. In the past, people with a cervix aged 21 to 24 received PAP tests across the country, but cervical cancer is rare in those under age 24, and screening more often detects abnormalities that will not become cancerous, leading to unnecessary testing and treatment, which is why many provinces feel it's safe to start screening at age 25. Those who have never had sexual contact do not need screening. People with a cervix should continue cervical cancer screening with a PAP test until the age of 69. Talk to your healthcare provider about when to get your next PAP test. Recent studies show that cervical screening for precancerous changes every 3 years is just as effective and safe as screening every 2 years. Having a PAP test does not get in the way of any of your daily activities, such as taking a shower, exercising, or having intercourse. The PAP test can show 2 types of abnormal changes in the cervix, low-grade and high-grade. If your PAP test results show low-grade changes, you will need to have a PAP test again in 6 to 12 months. If the changes continue, further testing would be needed. If your PAP test shows high-grade changes, you will need further testing. This is very important because there is a greater chance that high-grade changes are precancerous. The most common cause of an abnormal PAP test is an HPV infection. Other causes include infections and precancerous changes. Many women who have a PAP test that shows low-grade or high-grade changes will also have a positive HPV test. In most cases, your body will get rid of the HPV infection without treatment within 1 to 2 years. However, HPV infection can remain in the body. It can take several years for an HPV infection to cause precancerous changes of cervical cancer. A PAP test can help find abnormalities before cancer has a chance to develop. To see all the patient resources in this series, scan the QR code.